So it's very, very important that as an exercise leader and a fitness leader, that you're a very critical thinker of exercises. There are a slew of exercises. There's so many exercises to choose from. There's an internet that has an overabundance of exercises that doesn't necessarily let you know right off the bat if they are safe or unsafe exercises. So remember, someone could post a video of pretty much anything on the internet. And if you simply copy things without any thought, or else if you decide that you like an exercise and you just think everybody should do it, you might injure people. Because really, what might be effective for one participant may cause injury to another. So one individual might be able to do squats right down to like the 90-degree mark. The next individual might have degeneration in their knees, and they may be limited. It's very important that you choose your exercise because of the appropriateness, not because of novelty. And as someone new to the fitness industry, as I'm assuming you would be, you'll start off thinking, oh no, I would never do that. I'm going to choose the most appropriate exercise. But after you've taught a basic squat thousands of times, you're probably in your mind going to think people are getting bored with doing a basic squat and feel the need to come up with a fancy plie squat or some exercise that actually might not be very safe just because it's different. Don't fall into that trap. The most successful class I've ever taught, I have kept the same basic core movements throughout the entire course, and I'm talking going over 2 years now, and they do the same base exercises every time. So don't fall in the trap that novelty is better. And when we think of appropriateness, we're referring to choosing exercises based on individual skill level, degrees of strength, and participant comfort level. Individual skill level is key. One of my favorite exercises to do is a stiff-legged deadlift, also called a Romanian deadlift, that involves hip forward flexion with the arms in front of you, where you maintain neutral spine. I rarely teach this exercise, and the reason I rarely teach it is I have found that the vast majority of participants don't have the skill level to perform it correctly. So is it a good exercise? Yes, it is. Do most people perform it incorrectly? Yes, they do. And when they perform it incorrectly, they increase the risk of getting injured. So that's what we mean about individual skill level, as well as their degree of strength. You know, you might be able to cue a perfect push-up, but if the individual's not strong enough to do a push-up, then they're going to potentially injure themselves. They have to have enough base strength, and they have to be comfortable with it too. So an example for comfort level would be a barbell squat, and that is a squat where you hold the barbell across the shoulders, so behind the neck. And it's not on the neck, but it's behind it, all across the shoulders. And this one too, I work mainly with women, and I've had women panic at that exercise. You know, even though they are technically very capable of doing it, they're not comfortable with it. And I need to respect that and find an alternative for them. So really, there's 5 steps to analyze exercise. Is firstly, you need to know what the client's goals are. What are they trying to do? What are the targeted muscles? What are we trying to exercise according to their goal? Then we have to determine the appropriate joint movement or position. Does this take me through an appropriate joint movement? That's what I was implying when we talk about some of these plie squats that you see on exercise videos or on YouTube, where they're driving the knee in such an, and I'm not talking about a ballerina's plie, but rather the resistance training version, and they're driving the knee in such a bizarre angle, and an angle that's hard on the knee. So it would not be an appropriate joint movement or position on that one. And then finally, you're going to design the exercise in the program and then modify it as well, always doing safety checks. I work with very advanced females. I have been working with them for 2 years solid. I still have to constantly do safety checks, constantly check their form, constantly modify things. They are very, very talented individuals, but we always, that's why they're hiring me. That's why I'm there, is to make sure their form is perfect. And perfect, I should clarify, perfect for them. Not necessarily that textbook range of motion, but the range of motion my participant can safely handle. So here we have the SEAT model. You don't have to memorize this acronym, but memorize and understand that the steps are, what's involved. So we can really look at choosing exercises by looking at this model. The safety and stabilization, has that been met? The effectiveness of the exercise, how effective it is for doing what we want it to do. The applicability, how applicable it is to real life and functional, as well as time efficiency. Is it a very time efficient? Are you having to stop through the class to do a great deal of setup for this? How efficient is it? So safety and stabilization. You need to ask yourself, what's the purpose of this exercise? What are the major joints and muscles being used? And is it appropriate for the participant's ability? So here's an example where we could have a problem. Is the issue with this picture is the depth of which she's doing the squats. That's hard on the knees to squat so low. And I know some of you might disagree with this, and I know some of you might come from backgrounds where you do squat lower. However, a great portion of the population will have difficulties with this. This could be very, very hard on her knees doing this exercise. So what we recommend with the Manitoba Fitness Council is limiting the depth of the squat to approximately a 90-degree angle between the femur and the tibia. So joint safety. So some general things. With our knee, certain movements can cause injury to this joint. And one example will be deep bending or the full squat. So squatting very, very low. As we squat lower, it increases stress on the ligaments of the knee. So we really want to limit the amount of really deep squatting that they do. Other things that we really want to watch when it comes to the squat is we want to make sure that their knees are not shooting out way in front of their toes. So if they start to shift their weight into their toes while they squat, it will drive their knees forward. Now there is a little bit of forward movement in the knee when you squat, but excessive forward movement is very shearing and hard on the knee. The other mistake I frequently see with the squat is that the knees come together. So you'll see the individual squat down, bringing their knees towards one another. That is going to be considered poor tracking, and it also is very hard on the ligaments of the knee as well as the pull on the patella. So you really want to make sure when an individual squats that they do not go too deep, that they do not let their knees go in, and they do not allow their knees to go forward too far. In the fitness industry, though, we like to focus on what they should do. So you tell the individual to squat with their hips going back and their knees remaining roughly above their ankle or their foot, knees pointing forward. As I've mentioned, we want to potentially just do a half squat, so we would stop the individual at a 90-degree angle between the femur and the tibia. Other areas of concern are the vertebra. So remember, that is your spine, and the size and the shape of the vertebra and the intervertebral discs will allow the spine to move in multiple directions. And if you looked at the human spine in situ, so within the body, there are a multitude of ligaments that support the spine and help limit excessive movements. We should have a natural range of motion through the spine, but we should be avoiding excessive range of motion. Our spine is not made to excessively flex or extend or rotate or bend, lateral bend. It is made to stabilize more in the midline. So now this one, what she's doing here is she's actually doing hip flexion. Her spine is in neutral position. However, with her holding that weight behind the neck, this is an exercise called a good morning. And she does actually happen in this picture to be doing it with very, very good form. I have to say that. But when she's doing this, it causes a great deal of shear force on the lumbar vertebra, which means that the vertebra are being pulled by gravity anterior. And so in this case, that would be moving towards the ground. This is very hard on the spinal ligaments. And even worse, if she were to do this with her spine rounded forward. If her spine rounded forward, that's extremely hard on the ligaments in the spine. Extremely hard on the discs, extremely hard on the ligaments, and would probably increase the odds of her having a disc herniation. Other things that we want to watch when we're working with this vertebra and the spine is we really want to watch uncontrolled, fast, or weighted twisting movements, so spinal rotation, especially from a seated or a flexed position. And we tend to like to do this a lot. Like think about, we do ab curls with a lot of rotation in them. Our spine doesn't have that much range of motion. It appears to have more motion than it does because of the different segments. We have many movable segments. But to do these rotated, twisted movements are very, very hard on the intervertebral discs, especially when you are seated or the torso or the pelvis is fixed. Because our lumbar spine cannot rotate very much, if we are seated, what we tend to do is we feel like we should be able to go beyond a certain rotation, and we tend to torque and twist and use momentum to get us there. We don't want to be doing that. The lumbar vertebrae will only permit limited rotation. Our lumbar, or to remind you, your low back, lumbar vertebrae are best at flexion and extension, very limited at rotation. The other things we want to watch is unsupported prolonged spinal flexion or extension. If you are flexing forward and rounding forward or extending back, this can start to cause injury to your spinal ligaments and the intervertebral disc. I always try to caution people, there's nothing wrong with doing sit-ups, but we most likely don't need excessive amount of sit-ups in our routine. We probably would benefit a lot more from doing stabilization exercises such as single-armed weighted carries, or perhaps plank maneuvers or quadruped maneuvers, as opposed to hundreds and hundreds of sit-ups. That is a great deal of spinal flexion, and after a while that gets hard on the discs as well as the spinal ligaments. The other one that they often will caution against are sit-ups performed with the legs straight. So when we think about working the abdominals, we think of an ab curl. And an ab curl is, or a crunch, we'll call it a crunch as well, is the rib cage moving towards the pubic bone, rib cage to pubic bone. And that is where the rectus abdominis actually runs. Back in the day, we used to do full sit-ups, and that's where we would sit all the way up, and the chest would go up against the thighs, and we would go all the way back down. That was a sit-up, a full sit-up. Well, really, a full sit-up ends up working hip flexion. A full sit-up would work hip flexion, not spinal flexion. The abdominals will flex the spine. They do not flex the hip. So when we were doing these either straight leg full sit-ups, or else we were doing sit-ups with the feet anchored, okay, so that we'd sit completely upright as we did them, what was really happening there is we were working our iliopsoas, our hip flexor muscles. And if we have tight, overworked hip flexor muscles, or iliopsoas, we tend to have weakened abdominals because our hip flexors will tilt our pelvis anterior and forward, which will put our abdominals in a weakened position. So it's not very recommended to do full sit-ups, okay, even with a leg straight or else legs bent and hooked. We will talk about stabilization, and this is often usually about the core stabilizers. Core stability is the ability to maintain ideal alignment of the neck, spine, scapula, and pelvis during exercise. So it's really that ability to maintain neutral spine, which would have a natural curve in the spine and the body. Our spine is not straight. Our spine is curved and meant to be curved. but we're in a position where the ears are above the shoulders, which are above the hips, which are above the ankles. We want that alignment, and we want to learn to be able to strengthen our core body by bracing the core body. And when we brace that core body, to do it in a way that maintains neutral spine. So when we talk about core exercises, these are muscles that will train our pelvis, our low back, our hips, and our abdomen to work in harmony. Quite often when we think core body, we automatically think of an ab curl. This is where I would say arguably preferable core exercises would be planks, side planks, weighted carries, um, quadruped maneuver, or else like dead bug exercises where you're laying on your back, maintaining natural curve in the spine. So carrying on with our seat model, the E stood for effectiveness. So figuring out the most appropriate way to train the targeted muscles. So you need to consider things such as, what is the desired outcome? Are we looking for flexibility? Are we looking for strength or sports performance? What muscle group is intended to be worked? What are we trying to work? Is this the most effective way to train these muscles? Am I compromising safety for variety? So when it came to the ab curl question, and even though you still can do ab curls, but I would argue a more effective way to train the core musculature are planks and side planks. So I still might throw some ab curls, but I would never create a program that was just doing ab curls for core stability. That's not a very effective way. You could also look at time effectiveness, right? I will often choose for the lower body to do squats and lunges. Those are very time effective, and they're very functional exercises that we actually have to do in real life. So I would look at those for effectiveness. Applicability. How functional is the exercise? How does this exercise affect real life performance? Does the exercise directly enhance the performance of movements so that an individual's activities of daily living are easier to perform? Think about it that way, and communicate that to your participants too. Why do we have to do squats? Well, squats are the ability to sit down into a chair and stand back up. For an active older adult to stay independent, functionally independent in their own home, requires them to be able to sit down and stand up on their own. The moment they're unable to do that is the moment they have to go into assisted living. That a lunge, we may not like lunges, but lunges is the ability to walk up and down stairs. Shoulder press is the ability to lift something up on a higher shelf. So how applicable are they? Once again, I tend to be moving away slightly from a lot of isolation exercises in my programming. I like really applicable multi-joint exercises. That's sort of how my programming has been focused lately. So the primary goal of functional training is to transfer the improvements in strength to your movements of daily life. What do you actually have to do in daily life, and how do we strengthen that? And then time efficiency. So make sure that you're choosing exercises that are time efficient. So they maximize the use of the range of motion, that they use gravity, which will make it both effective and applicable, that you can use body weight exercises and proper levers, and that if you're using resistive equipment, that is both available and appropriate. I was mentioning I would much rather do squats and lunges than to spend my time doing ham curl, knee extension, calf raises, inner and outer thigh exercises. I could get so much more done with one single exercise. Now, if my individual is bodybuilding, they will want those isolation exercises because the isolation exercises will allow them to maximize hypertrophy in the muscles. But if it's average population, I would rather them do the most functional exercise. I've mentioned this already, to make that connection between the exercise conditioning and their lifestyle, right? So you really want to increase their commitment. So you always want to make it applicable to their lifestyle, and that they also end up improving beyond just the exercise class. So not just let's exercise here, but how can we change what we do day-to-day life to get more benefits from it? And always, always plan with the participants and their skill level in mind. So our functional evaluation criteria, so when I mention things being more functional, um, you need to ask yourself, does the activity match a daily movement pattern? Match real life in terms of timing, duration, and intensity? So once again, if we're spending all of our time, which I don't see often, but let's say you decide that you were just going to do nothing but isometric contractions for everything, right? Well, do we really do that, or is movement really more fluid? Not to say we never do isometric contractions in real life, but not everything would be like that. Does your activity that you're doing, does that reduce risk or prevent a decline? And then look at what muscle you're exercising. Does this muscle group usually bear or move body weight? Does it work against gravity? Does it conduct strength or endurance activities, or does it act as a stabilizer or mover? Once again, that's my abdominal argument that, for the most part, what do our abdominals do? Our core body stabilizes our spine. It doesn't do hundreds of ab curl crunching movements. It's functional. It's going to stabilize and brace when we're pushing open a heavy door or pulling on something. So I'd like to choose appropriately. Other things to keep in mind is what muscles are typically overworked, underworked, weak, strong, and inflexible. What ones need working? And also just because a muscle is tight doesn't mean it's strong. So just because we might be tight through our pecs doesn't mean they're strong pecs. They might need to be stretched and strengthened. Also, what imbalances typically occur because of the activity an individual does? So if they're constantly running, if they're a runner, then we're going to know that they're going to tend to be stronger in their hip flexor, and that we probably would have to do some upper body posture exercises. And also, who are your clients? Who are you working with? What activities do they need? Are these activities specific to what they need? Take everyone as an individual and use common sense. We want to make sure we're making the wisest choice for our participants. So some general rules. Muscles that tend to be weak are our hamstrings. With our hamstrings are our glutes. Our gluteus maximus tends to often be inhibited, so we want to make sure we're doing a lot of hip extension movements for the gluteus maximus, as well as the hip adductors, so the gluteus medius and minimus. So a lot of adduction or single-legged movements. Our rhomboids and our lower trapezius tend to need strengthening. So they tend to be weak, which is what gives us a protracted appearance. So we need to do exercises that move us through retraction with our scapular movement. Our triceps tend to be weak, as well as our latissimus dorsi. We tend to work with things in front of us, right? So our biceps are strong, and our pecs and anterior deltoids might be strong. So we need to work the back, which would also include our posterior deltoid. We sit hunched forward in front of computer screens all day, it seems. And so our posterior deltoid tends to be weak. Stabilizers that need strengthening, this is your core body, okay? So your erector spinae and your abdominals, as well as your adductors and abductors, especially in the lower extremity, our inner outer thigh. Now, I personally wouldn't spend much time on the abductor, adductor machines, but rather I would make sure that I was including lots of lunges and single leg work, unilateral work, to strengthen our abductors and our adductors. Muscles that tend to be tight that need stretching, and these are often because of our postures. Our gastrocnemius, our calf muscles, tend to be tight. Our quadriceps tend to be tight because we're seated a lot, and it tightens up especially the rectus femoris. And our iliopsoas, or our hip flexor muscles, tend to be tight. Our pec major and minor tend to be tight because we're rounded forward. Our hamstrings, remember I told you just because a muscle is weak doesn't mean that, or tight doesn't mean it's strong. So our hamstrings are not only weak, but they're often tight. And that has to do with posture. As well as our the stretching would be trapezius or upper trapezius. Our upper trapezius tends to be tight and shortened, so that needs to be strengthened, whereas our stretched, pardon me, our upper traps need to be stretched, whereas our lower trapezius tends to be weak and needs to be strengthened. Our levator scapula, so the muscle that lifts up and elevates the scapula, that also tends to be shortened and tight. Unfortunately, we walk around with our shoulders up around our ears. So we need to stretch to pull those shoulders down. And once again, because we spend so much time working forward with our body and working at computers, our anterior deltoid tends to be tight and needs stretching. So it's very easy to see how one side of the body tends to be tight while the opposite side tends to be weak. So let's just take a few moments here. I want to analyze a few different exercises and give some feedback on how we can change things. So first exercise is the squats. And we do a squat in order to strengthen our quadriceps through knee extension and our gluteus maximus and our hamstrings through hip extension. So when you're doing a squat, some things that could go wrong. You could increase your lumbar lordosis by doing it incorrectly. And what we mean by this is that is overextending the low back, okay? So where people seem to arch their back in a squat, that will increase your lumbar lordosis. Or perhaps you do the opposite, that you round the low back. Okay, so you decrease the lumbar lordosis and you round forward. That movement will increase your risk of a disc herniation. So increased lumbar flexion will increase the risk of disc herniation. Other issues can be patellar tendinitis. So if you're not tracking properly, so if your knees are not tracking properly over your ankle and feet, it can irritate the patellar tendon. So the quadriceps tendon going into the patella, into the patellar ligament. That area becomes irritated and inflamed. And then also, if you are doing a heavy barbell, sometimes people find discomfort in their neck. So things that you can do, you can make sure you can shorten the depth of the squat, so only going half depth, so maybe not even doing to the 90 degrees, and make sure you work in a pain-free range of motion. You want to make sure that their tracking is proper with their knees. So their knees are staying hovered over top of their ankles and the back part of their foot, that the knees are not moving inwards or not shooting far ahead, that they keep the weight in their heels. That will help them maintain positioning of the knee. That if you're having a hard time with the barbell, that you maybe just are doing body weight squats. And then I'm not totally sure how they mean holding a barbell behind the head while squatting. If you're having neck discomfort from holding a heavy barbell, you might be better off using dumbbells instead, or a trap bar, which is a bar that you have your arms straight down. You would never hold a barbell behind the head, so that makes it, to me, sounds like you're holding it balanced. If you're using a barbell, it's not actually positioned on the neck. It should be positioned on the shoulders. So it's a certain positioning there. Other things you can do instead of just a classic squat, you can do a ball squat where you have a ball behind you, in between you and the wall, so that you go down till your hips and your knees and ankles are all bent at a perfect 90-degree angle. Or perhaps they're doing a smaller isometric squat and just holding it until they get the strength up. Perhaps you're doing a leg press machine, because with a leg press machine you could do a lot less resistance. And the other thing with a leg press machine is if you're having any spinal issues, the leg press machine takes that out of the equation. The lunge. So the lunge, remember, a lunge is just a one-legged squat. So it's going to strengthen your quadriceps, your gluteus maximus, as well as your minimus and medius, as well as your hamstrings. And then they group together the hip abductors I've already mentioned, as well as hip adductors. Same kind of issues will occur. Increased lumbar lordosis, so they'll arch through their low back. That's hard on the posterior elements of the spine, so they want to maintain neutral spine by bracing. Disc herniation if they are flexing forward too far, so they round their low back. Patellar tendinitis, so same rules of tracking apply for the lunge as applied to the squat. So that knee needs to stay above the ankle. And then increased kyphosis. I find there is a tendency when people lunge. When you do a lunge, your upper body should stay upright. You should stay up. You don't bend forward at all. And for some reason, when people lunge, they feel like they need to bend their upper body down to bend forward. And they don't. They should stay upright. So simply cueing these things. So be aware of these issues. So if someone is rounding their back forward, you cue them to stay upright. If their knee is moving in the wrong direction, instead of moving forward or moving inside, I correct that. Other things I look for is to make sure the weight is being driven through the front heel, not the toe. I make sure that the feet are hip width apart, not like they're on a tightrope, but a little bit of space between the legs before they do the stride. How can I modify things? I might choose to do a stationary lunge. And in fact, if I'm working with more of a beginner, I'll definitely start them on a stationary lunge where they would hold the lunge position and just go straight down, straight up, and they could even hold on to something. From there, I would have them lunge backwards. I find it easier to lunge backwards and forwards. So they'd stand up, they'd step one leg back and go straight down. Then I could have them stepping forward with the lunges, and I could progress them to walking lunges. Once they know what they're doing, they have the stability. Alternative things I could do, I could have them do an isometric lunge. So maybe I have them just hold the lunge position and go part way down and maintain that. If I want to make it more difficult, and these ones will make it more difficult, I could elevate that front leg or elevate the back leg. That will definitely challenge the balance more. Or else if I want to make it quite complicated, I could use a Bosu. Okay, that's the half ball. It stands for both sides up, Bosu. And so if I put my front or back foot on there, it's going to dramatically challenge my balance, making the lunge harder. So push-ups. So the big muscle groups that it's going to strengthen, it won't strengthen the rhomboid so much. It'll be more the pec major and the triceps and the anterior deltoid. That is what's going to be strengthened by the push-up. As well, it's wonderful because it trains you more so than a chest press. It trains you to keep the entire body and the core body nice and rigid as you move your body through a plank position. So some mistakes that are made is people fail to keep their neck and their spine neutral. So they sag through the low back and they drop their head forward. I find that they hang into it. The biggest mistake I see is people drag their hips behind. So they arch through their low back. You also want to watch, I tend not to see this one as much, but technically overextending the elbows. You want to make sure they're not locking out at the elbows. So things that we can do to make things different for the push-up, we could reduce our lever length. Okay, we could do that and make it easier by placing our knees on the floor. That shortens the lever. When the lever is shorter, it's not as hard of a job. We could also sort of change things where we put our hands up higher. It's going to change the angle at which gravity pulls on us, which will also make it easier. So this will be reducing the effect of gravity, and we could keep elevating the hands higher and higher until potentially we're doing it against a wall. If we want to make things harder, we can actually increase instability with our hands on a Bosu or stability ball. Our hands, or we can put our feet up on the Bosu or stability ball. Makes us less balanced. Alternative things, so a kneeling push-up, that's reducing the lever. We could play around with our hand width. So if our hands are more narrow, it's going to require more triceps because it puts the chest, the pecs, at a disadvantage. Little bit wider is going to be more chest. Don't let the arms go too hard. It'll get hard on the shoulder joint. A full push-up would be from the toes. That would be more challenging. Or else if I want to make it even more challenging, I could do a decline push-up. So I would elevate my feet onto a bench. And then it takes me, it's going to make it more challenging from the angle which I'm working. Abdominal curls. So really why we do an abdominal curl is to strengthen our rectus abdominis. And so where people go wrong with this, so people will do excessive neck movements, so they'll pull with their neck. Technically, you have to watch for lumbar hyperextension if you're using a stability ball. For the most part, I actually find it's the opposite. It's hyperflexion. So the person's trying to lift themselves way up when really all they need to do is move the rib cage towards the hip bone. So instead they're trying to crunch to get themselves high off the ground. That would be excessive lumbar flexion, and that would be hard on the discs in the lumbar spine. So avoiding excessive neck movement, I could change around my arm position. So I could have my arms resting on my legs or across my chest or overhead. I could also have my feet supported on the bench or wall. I could have my body positioned differently. So maybe I'm working on a football or a Bosu. If I'm having excessive neck movement, I could train the individuals to lift with their rib cage and not with their chin. And I could simply cue them not to go too high. So I always use a cue, rib cage to hip bone, rib cage to hip bone. Other things that they can do instead of an ab curl, they could do a pelvic tilt. Or else if they really are lacking the strength, maybe they're doing Kegels or ab bracing before they even worry about trying to lift part of the body. So some safety considerations. When exercising, and this especially, this can happen anytime, but tends to be more frequent with cardiovascular training, is when should a participant slow down or stop? So these are going to be signs of over-exercising, where usually their heart rate's starting to get too high. So absolutely, if the client requests to stop, let them stop. Okay? So if they perceive that they're in too much discomfort, allow them to stop. If they're all of a sudden experiencing undue fatigue, so they're doing a class and they are suddenly absolutely exhausted. This one I always will slow down or stop, and this is also with resistance training, if they're no longer doing proper form or technique. If you're no longer doing a proper push-up, I have you stop the push-up. There's no point training bad technique. If this is a fitness class or like a cardio class, if all of a sudden if their movements become abnormally sloppy or uncontrolled, that would tell me something was going on. If they have a breathing issue, so all of a sudden they start to wheeze, or they have severe onset of shortness of breath, so all of a sudden they're gasping and they're having a hard time breathing, I'd have them slow down or stop. If they're dizzy, they have any kind of confusion, if they change color, if they go pale, or especially if they go blue. Dyspnea means a hard time breathing, or nausea. If they're experiencing those, I have them slow down and stop. Cramps in their lower upper body, I have them slow down or stop. Ataxia is a loss of muscle coordination, so if their movements are just going weird and not working properly, slow down or stop. If they have vertigo, which is dizziness, visual or gait problems, slow down or stop. Suspicion of heart attack or angina, that's chest pain, slow down and stop. Or any other sudden changes. So now, these ones we all kind of watch. And when we say slow down or stop, we don't mean like, okay, stop, stand still. Remember, we would put them through a cool down. But if all of a sudden the individual just feeling a little bit off, I would have them slow down what they were doing. So if we were doing, say, we're doing jumping jacks, I would have them do a lower intensity jumping jacks. So maybe they're doing heel digs instead. Or if we were sprinting, I would have them slow down to a jog instead. Okay? And if they seem to recover from that, they can try to increase back to their intensity. But if that slowing down is not sufficient, I have them stop. So they would go into a cool down and like continue to decrease intensity until they've come to a stop. Okay? Ones that we're really, really watching, that any kind of heart pain, that angina, that would be immediately go into a cool down. Ataxia, immediately go into a cool down. Anything that seems very out of sorts. I always say that when people, you'll see their pallor will go, especially high intensity stuff, that all of a sudden they look confused to a degree. And I'm not talking they're completely disoriented, but they just seem off all of a sudden. I'll have them cool down. So I'll do a lot of burpees in my class. So they'll be doing burpees, and all of a sudden I'll look and someone just looks off. Their movements aren't as coordinated. Their color's a little off. Usually I'll walk over and go, just do some squats instead. Stand up, do some squats, catch your breath. I would say 99.9% of the time they do that for a minute or two, they're able to rejoin in. Okay? But anything more, always get help. Don't ever just push through something because yes, like something bad can happen. You need to respect their limits. So there can be issues. People talk about a stitch or a cramp, right? Um, Stitches are more in the diaphragm, so all of a sudden that cramping sensation in a diaphragm or a muscle cramp. If they are getting mild stitches or cramps, have them just calm down their intensity a little bit and see if it goes away. And so, usually, if it's a side stitch, I'll have them do some forceful exhales as they slow down the intensity. That usually clear up. If they're cramp, I have them do smaller movements. And usually they're calf cramps. That's usually what I find. A smaller kind of movement, see if it eases up, and then I'll have them gradually return to their intensity, assuming it stays away. If for any reason it doesn't go away, you take them into a cool down and reevaluate at that point in time. Perhaps they're dehydrated, perhaps they maybe hadn't been eating enough. You could always come back to exercise another day, so be safe. And also, um, there are issues too where participants will have prolonged fatigue. So this is getting into the overtraining, that they're coming back class after class and they're exhausted all the time. We got into this love of high intensity stuff, and sometimes we forget that exercise is supposed to benefit the rest of our lives, not take away from it. So if you go to a class and you're giving 110% every single class, and you're leaving class and you are exhausted and tired and can't move and you hurt, then that class is not benefiting you anymore. It should strengthen the rest of the day. You should, yes, you will be tired at the end of the class, but you should be stronger for a class, not weaker. And it's also worth noting that dizziness is not okay. So if somebody is experiencing dizziness, we need to change things up. If they're dizzy, they are at a higher risk of falling or injuring themselves. So sometimes they're dizzy just because they're working at a little too high of an intensity. It might be an issue with their blood pressure. Their body might not be adapting. Bring back the intensity. Dizziness can also potentially be an issue with blood sugar levels. You want to return, okay? So what we would do, and it does say here the activity should be stopped immediately. Like yes, no. What they mean by stop immediately is, let's say you're jogging and you're getting dizzy, then we're slowing you immediately down to a walk for a minute or two, and then we'll sit you down. Okay? If it's extreme dizziness, you would actually have the individual stop and lie down with their legs in the air for like with their legs elevated. That would be an emergency stop. But for the most part, you'll find most participants can go immediately into a cool down and then stop from there. Okay? So once again, if it's extreme dizziness or something's extremely going wrong, you would lie them down, lift their legs up. So the RICE principle, we are not certified to treat injuries. You will have your first aid. So first aid allows you to deal with acute meaning immediate injuries. So we're not talking about rehabilitating, but rather something happens immediately. You are going to follow the RICE principle. You should rest, immobilize, put cold on it, and elevate it. At that point in time, so any musculoskeletal, they sprain, they do any kind of injury, rest, immobilize, put ice on it, so cold, and elevate, and you send them to a healthcare professional to be further evaluated. Okay, so you just deal with that acute. Essentially, all you're going to do is keep care of them until somebody more qualified takes care of them. So emergency procedures, make sure you're aware of the procedure for your facility, know where there's a phone that you could use, know where to find a first aid kit, know where the emergency exits are, be familiar with the protocol, and know where you are. If you have to call 911 and you don't know what street you're on, the street address, you need to know that information to get emergency personnel to you. There are different emergency procedures for different places. And it's really important that you are aware of emergency plans at different facilities. What do you do? Are the front desk staff trained that they could take over from you immediately? Where is the first aid kit? What paperwork do you need to fill out? There's usually incident reports. Find out that information. When in doubt about anything, dizziness, chest pain, anything, if something doesn't seem right, call 911. You'll know, and as a leader, you will know what normal fatigue, that when people are breathing just a little too heavy, what it feels like, what it looks like when they need just to calm down just a little bit and decrease intensity for a few minutes. You'll start to see that difference between them and someone that's experiencing an asthma attack. There's a very, very big difference. And until you can easily see those signs, talk, communicate with your participants, and call for extra help when you need it. So before a participant starts a fitness program, they should be screened. And this first step will really help you find out information. So it'll tell you about an individual's health status, and it will let you make appropriate recommendations for health and fitness improvements. So this leads us to the PAR-Q. The PAR-Q is a questionnaire that was developed in Saskatoon, and what it was developed for was to screen out home exercise participants that might require extra medical screening. We've taken this original participant questionnaire, okay, physical activity readiness questionnaire is what PAR-Q stands for, and we've improved it, okay, and we have updated screenings that will deal with false positives. Through the MFC, there is actually a continuing ed webinar link that you can go to see exactly how you use it. But let's just take a look at it on the next slide. Okay, so this is the updated PAR-Q, okay, Participant Physical Activity Readiness Questionnaire. What it is it's 7 questions. The original also was 7 questions long, and that you have the individual answer this. So if you are going to join my fitness program, I will give you a PAR-Q Plus to fill out. I will hand it to you. I will say, please read these questions and answer to the best of your ability. The individual will either answer yes or no. In the original form, if they answered yes to any of these 7 questions, they had to go get a medical note from a medical doctor. They had to get a PAR-Med-X filled out by a medical doctor to clear them for fitness activity. When we improve the PAR-Q to the PAR-Q Plus, what this now means is that if they answer yes to a question, they then have follow-up questions. The follow-up questions will be further in the PAR-Q. It'll tell you what page to go to. If you said yes to this one, complete page 2, and you'd answer more questions. This was to rule out false positives. Back in the day, there were individuals that might have controlled conditions, or they might have answered things without understanding the question and had to get medical doctor's notes for issues that would not stop them. The PAR-Q Plus gives further clarity. It gave a little bit more information. So you'll notice question 6, right? Do you currently have or have had a bone joint or soft tissue ligaments that could be made worse by becoming more physically active? Well, it used to be phrased differently. That was like, do you have anything that can get worse with activity, like a bone joint thing? And so people all said yes, and then we had to turn them around to see their medical doctor. So the PAR-Q Plus does screen out false negatives. It's very, very effective. What the PAR-Q does do for us is it lets us know if we need a medical doctor's insight and approval for physical activity. So if you have a PAR-Q positive, that indicates you need to see a medical doctor, and you would fill out what's called a PAR-Med-X, a specialized form. You are not, as a fitness professional, allowed to interpret this form for them. So they go, well, what do you mean by a heart condition? You need to say to them, you need to answer this on your own. You have them look at it. If you interpret this for them and something happens negatively, and this goes to a court of law and you've injured somebody, and you have interpreted this form for them and steered them towards a certain answer, this is going to put you in a huge role of liability. You'll be in a lot of trouble. So I always encourage participants, please read this, please answer this to the best of your abilities. The other thing too that I should mention, these should be done yearly. Okay, so every year this should be on file. That if they have a PAR-Q positive, they do require a visit to a medical doctor. Okay, after they've answered all the extra questions, if it comes back that they require a doctor's note, you need to send them, and that they should not actually be participating until they have that note. This can be a frustrating, difficult situation for a fitness leader because some individuals will get very angry that they can't start right away, but you need to stick to your guns. Remind them that this is done for their safety and that it's for their best interest. So even if they get mad, then you say, I need to send you a medical doctor. They're mad. You say, this is to keep you safe. This is to make sure that you're able to. Some medical doctors will give them full clearance, that they'll say, yep, the person's fine. They could exercise, in which case they could be in your class. Some medical doctors might feel with the individual that they need to work with a specialized, more degreed individual. And this is why Canadian Society for Exercise Physiology has certified personal trainers and certified exercise physiologists. Those are degreed individuals that that participant might have to work with. There's a group of individuals that all require extra screening, and these are going to be pregnant women. So they would do a PAR-Med-X for pregnancy, PAR-Med-X for pregnancy. So if a woman indicates she is pregnant, she fills out the form with her healthcare provider. It could actually be with her midwife or nurse practitioner or her OB. And this is to confirm that it's safe for her to participate in a fitness program. All pregnant women would get a PAR-Med-X. Individuals that have a PAR-Q positive also would get a PAR-Med-X. So there's some other forms that you might choose to use as a fitness professional. The first is a health history form. This is going to be a detailed questionnaire that gives you more information about what your client is like and about their wellness. So this form can have questions that ask about their diet, their sleep patterns, stress level, current and past physical activity levels, interests. You could pretty much ask almost any sort of information you'd like. I really like these forms. I often on this one too will be asking them ideal times and days that they could commit to exercise. So it allows me to really create a nice rounded program for them. And you might want to use informed consent. An informed consent document will inform participants about potential risks. So it would say, things that could happen in this fitness class are negative side effects can be. Just because you have an informed consent document does not waive you of liability. So just because you inform them that there was risk, you are still expected as a fitness professional to take every precaution possible to avoid things from happening. So you can still have issues with negligence just because you gave them an informed consent doesn't mean that you're free of negligence. You still have to do your job. And that's also true with the waiver. That's a legal form that will relinquish a participant's right to pursue legal action against the fitness leader or the fitness facility. Waivers tend not to stand up that well in courts. They tend to be worded poorly. There tends to be more involved with it. I've actually never used waivers before. There's a lot more. So just because someone said, I waive the right to sue, it doesn't actually stop them from having the ability to pursue legal action if you are found to be negligent. So little legal considerations beyond the health of the participant. Stuff like environment. So the gym itself, the facility where you're exercising, the space that you're using, you want to make sure that it's safe. So you want to make sure that there's no obstacles on the floor, that the ground's not dusty. That's always one that worries me a great deal. You go into some facilities and the ground has a lot of dust on it, which makes it quite slippery. You want to make sure that there's no water on the ground that could cause slips or falls. You want to make sure that there's appropriate heating or cooling systems, air circulation, lighting. You want to make sure it's appropriate. So if you're doing high impact, you want to make sure you're using a proper floor so you're not exercising on concrete. One I always say with seniors, I'm always watching on seniors that you're not exercising on carpet and expect them to do movement changes. They'll struggle with that. Make sure that there's no low hot hanging bars or anything that people can hit their head on. Make sure it's tidy and clean. The next legal consideration is environment. So make sure that you're using not environment, equipment. Pardon me, equipment. You want to make sure that you're following the guidelines for the proper use of equipment. You want to make sure that it's in proper quality and shape. So you're not using Dynaband with tears in it, that you're not using cables with frays in it. And you want to make sure that it is being maintained appropriately, cleaned appropriately, so that the equipment itself can't fail. And finally, your scope of practice. So the Manitoba Fitness Council provides a detailed scope of practice with each certification. You are only allowed to practice inside your scope of practice. So we've mentioned, and we will be mentioning lots, that you do not have the ability to diagnose things. So even though someone's describing something that sounds an awful lot like a rotator cuff injury, you are not legally allowed to do that. If you do not have your individual fitness leader certification, you are not legally, through your scope of practice, able to work one-on-one with individuals. So those that just have resistance training or the group fitnesses, those are for individuals that are working with groups of individuals. So really, please make sure you're within your scope of practice. And if you're not sure, please be in contact with the Manitoba Fitness Council and they could clarify any concerns you may have. Legal liability is categorized into the following areas. There's an inherent risk. So it's understood that even when everything is done properly and correctly, there's still an inherent risk that can exist. So it's not someone's fault. Someone didn't make an error. There's simply an inherent risk. Negligence, however, is when the facility or the instructor failed to do something. They failed to keep a participant safe. They failed to meet the standard of care or failed to correct something that was wrong. That is negligence. And that's why, as a group fitness leader, you're not allowed to work one-on-one, because your liability increases when you work one-on-one. That if you're only watching one individual and they do it incorrectly, then your negligence is more of an issue. Because if you're working with a group of 25, it's understood that there's an inherent risk working with a group of 25 that the instructor can't watch every single individual every single moment. There's an inherent risk. However, when you're one-on-one, that individual is paying you and has hired you to make sure they're doing it safely. So therefore, liability increases. There's also product liability. So the manufacturer of fitness equipment is at fault for defective equipment. So something, you do everything right and the equipment itself failed. That would be product liability. So it's just some general ethical guidelines. This is just a cycle. This keeps changing as you grow as a fitness leader. So you make sure that, first of all, you have the right combination of education and training, that you're guided by the best interests of the group that you're working with, that you provide a safe exercise environment, that you maintain appropriate professional boundaries, that you uphold a professional image, and that you use truth, fairness, and integrity to guide your decisions. And then that cycles back to having that right combination of education and training. And it's constantly cycling. You're constantly improving. You're constantly growing. So examine the push-up and what are some risks associated with this exercise and how can they ensure its safety. Once again, a lot of lumbar hyperextension or neck hyperextension where they're not able to stabilize properly. So if they're unable to stabilize properly through their core body, then what I would do is I would make the exercise more simple for them. So I would have them do the push-up from their knees as opposed to their toes. That would be a way of making it safer. Or maybe I would have them elevate their hands on something, which will also make it easier because it's lessening the pull of gravity. The differences between the PAR-Q and the PAR-Q Plus. Uh, First of all, the similarities is they both have 7 questions. It's done for health and medical screening. That if you answer positive to one of those questions, and if in the PAR-Q Plus the following questions are also positives, you require medical doctor's approval for exercise. Okay, those are the similarities. The differences is the PAR-Q Plus clarifies those 7 questions. The PAR-Q Plus asks additional questions to confirm that this is indeed a positive. So the PAR-Q Plus got rid of false positives. But if on either the form you end up with a positive, you require a medical doctor, a note from a medical doctor, or have a medical doctor fill out a PARMED X. And it's important to note that both should be done yearly. They should be kept up to standard. You should keep the forms for that year that you're working with the individual. And how can you show negligence during a class? Maybe during a class you get chit-chatting with a participant and you're not watching the form of other participants and they get injured. Or maybe you're at the front of the class too concerned with your own workout that you're not paying attention to what somebody might be doing incorrectly. They get injured. Or even worse, you fail to correct them when they're doing incorrectly. Or you choose an exercise that would not be safe for that individual and they get injured. That would be ways of showing negligence.